But it's also an opportunity for people who joined the last session last time to ask questions if they want to. I'm happy to answer. So, any one of you got some question regarding Circle, please? I suppose not now, maybe later it will come. All right, so I will do a demo specifically for 4D Flow today. And of course, if you have any question during the session, you can interrupt myself and ask question. So I will just share my screen in a few seconds. Just a bit of time to, okay. So in the 4D flow, of course, on the acquisition side, you need to have the specific sequence for that. And as well, you need to have specifically 3 phases in each direction and 1 magnitude. This is mandatory in order to have the software description of the sequence. And as soon as you have, directly the reconstruction done, so the 4 different series, the 3 phases and the magnitude, you will be able to drag it in the 4D flow window. I am here in the 4D flow module, and then you will see different steps, okay, different tabs on the top. So pre-processing, this is where we will be able to make some correction, the offset correction for the static tissue correction, and as well the anti-aliasing, if there is aliasing inside the different phases. To be honest, it's very rare to see aliasing compared to 2D flow, but at least if we see aliasing in the phases, so I can scroll and I could see like on the phase images, if I have any aliasing here, so I could apply the anti-aliasing if I'm seeing them. And so I always recommend to put the offset correction, so the static tissue correction, and then I apply. And here I have also a first visualization of my flow, so I can run the scene, and it could be good to have a first visualization here when I'm doing the correction. The yellow pixels are for the mask of the static tissue, and the blue pixels are the mask of airfield region for the anti-aliasing. Okay. But of course, we don't apply the anti-aliasing if it's not necessary, because it will take time of calculation for nothing at the end. So let's say we are happy about the different correction here. We can move over the segmentation. So it's not mandatory to follow these steps, of course, but let's say, I could go directly in the analysis, then in the pre-processing. I'm completely free to go as I want. And I can always go back to the segmentation when I am in the analysis if I want to focus at the end on the aorta or stuff. So the segmentation is not mandatory, as I said. We can keep the whole volume and we could place plane wherever we want without any problem. The advantage of the segmentation is if you want to focus on the aorta or pulmonary artery, for example, any vessels, it could be good to make a center line. And the big advantage of the center line is you will have your planes automatically perpendicular to the center line if of course you place one. So here you see the segmentation is based on the PCM array. So you could, if you want, use the crop or the scissors in order to move, delete a bit of volumes. Okay, I'll keep some. And I have also another tool. For example, if I want to go over the aorta, I could do like right mouse click clipping, 3D region grouping, and I could extract like that some of the volume, you see. So I could, it's kind of threshold, which could be growing, and then I can do right mouse click, saying that I want to keep this volume. Okay, and then again, if I want to use a scissor, etc., I can switch between the different tools without any problem. If I want to go over the aorta, and if I want to place a center line, I can always activate the tracer vessel center line. It will become in green. Then I do a start point, and I can make an intermediate point, but as well I can always push a bit more and make an endpoint. As soon as you do like 2 clicks, you will have this message, small or large. So when you are focusing on the aorta, okay, or pulmonary artery, you will be able to go for large algorithm. And then you see that I can fix a bit my center line. I can add some dots. I can turn around to see if I'm in the middle. I can even go a bit more inside in order to trap valves, for example, if I want to. Okay, I can move a bit. I can easily delete a dot with the right mouse click if I want. So it's not necessary to spend a long time on this part, but I'd say it could save a bit of time in the analysis if you have a center line here. I always advise to keep one of the segmentation volume in order to keep. I can always do a right mouse click in order to create different segmentation like that. And in the analysis, I will be able to select which segmentation I want to look. And of course, there is a reset if needed. In the analysis tab, so I can, as I told you, I can switch between the different segmentation I did. So here I just kept aorta and volume, okay? So as I told you, the big advantage of the aorta, you see that because I did the center line, my plane will be placed automatically along the center line. But as you see, you can always adjust a bit center line, okay, with the double oblique here if I need to put a bit more perpendicular. If it's not the case, that's not a problem. And you have an auto-contouring tools here in order to craft your flow curve and your flow results. In order to have the flow results, you just need to add the measurements, okay? It will save the last plane and create a new one. So that's the result, but for visualization, we have 5 ways of visualization. First, this is a simple velocity. Then you have the vectors, okay? And this, you could say some video, etc., etc. Pass line per plane, it's just you can see what's going in and out of the saved plane. Then, so you see that every time you let the mouse, you have the definition of the tool as it is for our software. Pass line and streamline. So streamline is the, let's say, most common use because you can see easily the turbulences. Okay. If you want to fix your contours, you can use the first one because the first one, this is the only one which will appear as well on the double oblique. So sometimes if you want to focus, for example, on regurgitation, or if you have an aortic dissection, for example, and you want to make a plane in the wrong and true channel, it's easy like that to define which flow is in which vessel. Okay. So 5 ways of visualization. Then here you will have the curves and the results. And if you want to look at the volume, you see that I could place my plane wherever I want, but of course I have no center line. That's why I will need to adjust a bit here my plane. So make sure that when you adjust your plane, I am on the green plane. So my green axis will be the one which need to be perpendicular to the vessel. Okay. Then I can run a bit my flow to see if I'm properly good. Okay. And if I'm happy about that, for example, I could say that this one, I could save it. Okay, so I add plane, I do right mouse click on the flow 2 in order to say this is my QP. And I could go now in the auto. This is just to show you, but this is how we can go over QPQS. So I do like a plane in my auto, I adjust a bit. I'm looking at the I can fix it. When I need to fix a contour, I need to be sure that I'm in phase number 1. because sometimes so the software will forward the correction of the contour. So if the beginning of the cardiac circle is good, that's great. But if the whole cardiac circle is bad, just please start in phase number 1 in order to, of course, fix the whole cardiac circle. And then I save it. I do a right mouse click to say this is my QS. And then I have my QPQS. Okay. I can as well change the color scale. If I want to focus on the peak velocity or stuff like that, I can also always adjust a bit here the scale. And then, so that was the flow, but I can also look at the wall shear stress if I want. Let me go back to the aorta. So you have the wall shear stress. If you want, you have pressure energy loss. So imagine you did like different flow planes along your aorta, and for the wall shear stress, you want to quantify exactly in the same position. You have here an icon in order to retrieve all the planes you did during the flow analysis. Okay, just in order to lose again the time to make proper position of each plane, you can retrieve like that the flow planes position. Okay, so of course we talk about the aorta or whatever, but see that you could really try to find your valves, for example. So I could try easily to find some long axis. I can easily recognize here the valves. Okay? And I can quantify like that. So, I mean, there are a lot of options in the 4D flow, but you see that it depends on what I want, but I focus on flow or shear stress or whatever I will need. It's more than possible, of course. And yeah, if you want, you could also get some intracardiac. So the intracardiac, for that, you need to have Yes, tell me. Any question, please? Sorry, I heard some noise. I thought it was a question, but don't hesitate if you have any question. I know that 44 is not the easiest part, so please don't hesitate. For the intracardiac, you need a 3-chamber view cine if you want to go over artificial intelligence tracking of the valves. So you click on the AI, you will have the definition of aortic and mitral valve. Then you click on tracking on the valve in order to have the superposition between the 4D and the CNA. And as soon as you do that, you will see your curves, aortic and mitral valve curves and results. And then if I want to go over the intracardiac, I need to put the volumetric correction phase. So when you have, let's say, the closure of the valve mitral and the opening of the closure of the aortic valve and the opening of the mitral valve, sorry. So more or less, let's say, change the value here. So I will put 12, for example, and then I can run the intracardiac. So the intracardiac, that's the goal, is to have the LV component. So I will be able to quantify the particles which are coming from the LA going to the LV and staying in the LV at the end. The particles coming from the LA going to the aorta. The particle which was at the beginning in the LV going to the aorta, and the particles which were at the beginning in the LV and which should stay in the LV at the end. So we will see that we will have these 4 groups of particles, and we will be able to have a quantification and visualization of these 4 groups. So this is, let's say, a real push for LV, okay? So the intracardiac goal is really to have tracking of the valves, but in the analysis, you saw that I was able to place planes wherever I want, included the valves, but of course the valves are fixed. Okay, so if you want absolutely a tracking of valves, you will need to come here in order to have it. Here I should be able to see in a few seconds the quantification and the visualization. Here you go. You see that I have 4 groups of particles, and I can also see the four groups of particles. Okay, so yellow and green coming from the LA, and you see that the blue and green is going to 0. Okay, so it's a bit, let's say, already push for analysis, but the goal was to show you a bit what Circle can do. So there are a lot of different tools. This is, yeah, specifically for the 4D flow. Any question, maybe? There are a lot of different tools for clinical use, for research, but yeah, I mean, it could be interesting. Most of people. Yes, sorry, tell me.
Okay, I have a little question. I see the last image you showed us. The last image you showed us with a lot of different flow in the heart. Yeah. Can we run the same images for the same imaging for the something like the brain to check for flow within the blood-brain barrier region?
In the brain, you say, right?
Yeah.
Yeah. So the brain, I have seen. So you need to understand that the software isn't for the heart. So we have the approval for the heart, but I saw many seen a lot of hospitals using the 44 for the brain, and the quality of images is good enough, and you can analyze them. But let's say the AI couldn't work, of course. But they have a lot of sites. They just use the analysis directly here, and they will make different planes wherever they want. And per plane, you can choose a color as well. So if you want, I mean, you're not gonna have a quantification like we can have for the intracardiac, but at least you can make different planes wherever you want in the volume, in the veins.
Okay. So one more question.
Yeah.
I was not in the previous class, but I see the software also has the capability of giving you something like a graph to quantify your images in terms of numbers. I see you see this graph at my left hand that shows the
So which graph are you talking about?
The one
Because
with green, blue, and yellow.
You mean like maps? T1 mapping?
Yeah.
Okay, because we have like it's maps like color maps with T1 mapping, T2 mapping. We have also like different absolutely.
I'd like to see other mapping. I don't know if the software also gives us the capability to see other mappings.
So the mapping is done automatically. You can use directly the map of the MRI, okay, and you will have the AI apply, and you can go over the CV if you want. So it's it's done completely automatically. I will show you in a minute, but yes, absolutely, you could have color maps as you asked me, some colors.
Finally, permit my too much question. I know the MRI system has a way of correcting for motion artifacts.
Motion correction particularly is used for mapping, yes.
So does the software also have some kind of for the flow, because sometimes you get some imagings from some patients that really you just have to manage yourself too.
So for mapping, the motion correction is particularly applied for perfusion or for mapping sequences. Okay. The 4D flow is free breathing. Okay. And the mapping, you will use directly the MOCO sequences, so the motion correction sequences, and for the stress or rest as well.
Okay.
I mean, all the vendors, they have motion correction, and their motion correction is good enough. And then in the software, you can push directly the sequences where you have already motion correction applied.
All right. Thank you.
Welcome. If you want additional trial license and additional training, if you want to see something particular, you can come back to me and ask me personal training. That's not a problem.
Yes. Definitely, I will.
Thank you. And I have one question.
Yes.
You went through different flow visualizations, and one of them was the vector. Could you give us examples as to what the vector visualization?
Yes, let me be back to the 4D flow because I jumped on the mapping for Ari. So at the end, it's just how you visualize the flow. Or you want to see like velocity value, or you want to see direction of the flow. It just depends on what you want to see. So the vectors are just quickly the direction of the flow. Okay. The streamlines, it's more to see like lines of the particles, and it's like that you can see the turbulences. It's a simple velocity flow visualization. It's just simply to see where are the peak velocity, where are the highest and lower value. Okay, so it's just different way of how I want to visualize the flow, but at the end, everything is the same. It's just if I want to make sure that the direction is, I don't know, perpendicular to the wall, for example, or if you see this turbulence, or just, okay, my interest is to find the peak velocity, so I don't care about the direction. I just want to see the colors with the velocity value, and that's it. So just, I mean, depends on what you want to see, but everything is flow. Okay.
Okay, so it's more from a visual perspective.
Exactly. And if you want, you can also decrease the speed of the cine or increase more or less the density of particles if you want to see a bit more colors, let's say. Does it answer to your question?
Yes. Thank you
Sounds
very much.
good.
And is the 4D flow available in the trial?
Yeah, in the trial license,
page
usually
of the
we
CVI
put
software.
I think in the trial version, usually we put MRI, strain, and 4D flow. I need to check. But in any case, if it's not the case, people who are already interested in 4D flow and say have some cases with 4D flow, because for that we need to have some cases with already the sequence on it, they can come back to me. I will check, but usually it should be included, but maybe we're thinking to focus only on MRI basic aspects, so maybe it's not included, but I will check. Okay.
Okay, thank you.
Seeing any question in the chat, but please feel free to just speak and ask question if you want. I hope it was clear. I mean, I didn't put in details because the goal was to have an overview on the 4D flow. But of course, if you want to try and yeah, you need additional training for anything. I mean, not only for 4D flow, you can come back to me.
Well, I guess if there's no more questions, we can